Another video that we want to add to our monoclonal antibody course that you can find over on my channel that breaks down all different types of monoclonal antibodies for different conditions is a lesson on Remicade, which is the name for the drug Infliximab. This is an IV infusion that's given to patients to start at 0, 2, and 6 weeks, and then it's maintained about every 6 to 8 weeks for a dose. This is used for a variety of inflammatory conditions that include Crohn's disease, psoriatic arthritis, and plaque psoriasis. And it's targeting an upstream pathway in that inflammation, which is TNF-alpha, or tumor necrosis factor alpha. And this is a specific protein that's secreted by cells at a higher rate in these inflammatory conditions that goes on and attaches to other cells like immune cells, endothelial cells, fibroblasts, and bone cells. And that's because these cells have TNF receptors, receptor 1 and receptor 2, attached to them that allow TNF-alpha to bind. Once it binds, it's able to recruit immune cells that then can release cytokines causing inflammation, but it also can trigger apoptosis or cell death in some of these cells, leading to tissue damage. However, Remicade is used to bind specifically to TNF-alpha, as this monoclonal antibody is specific for that protein. By binding to TNF-alpha upstream, it's able to prevent that protein from interacting with these downstream cells, therefore decreasing the recruitment of immune cells and decreasing cell death associated with these inflammatory conditions. However, Remicade is also able to bind to receptor-bound TNF-alpha. That is TNF-alpha that's being produced directly at the source by macrophages or dendritic cells. So essentially, it's acting on two different branches of TNF-alpha production. Free TNF-alpha that's floating in the cell, and that TNF-alpha that's just coming off the assembly line. So you can almost think of Remicade as blocking water production by not only clogging the drain, but also by shutting off the faucet. So if you have another drug that you want to learn more about, make sure to stay connected to my channel and with Dane Garvin by dropping a comment on that drug below. Thank you for watching my latest video. And if you're not already, make sure you're subscribed to the channel by clicking over here. And you may also enjoy a related video that I have, which you can find by clicking over here. I'll see you on the next one.